Hi, everybody, and welcome in. It's time for another edition of WAJR's Ask the Expert, sponsored by HealthWorks, Rehab, and Fitness. I'm Tony Caridi, and our topic on today's program is your lower back. Understanding treatment of low back pain. Why does it happen? What can you do? How can we fix it? It's being sponsored by HealthWorks, Rehab, and Fitness. And joining us in studio, Amy Lancaster, who is the clinical director of HealthWorks location in Westover, and Dr. Matt Lively from Mountaineer Orthopedic Specialist. He's a primary care and sports medicine doc there. Hello, guys. Good to have you here.
Thanks for having me here, Tony.
Let me check posture. Is everyone's posture nice and well as we get ready to talk lower back?
Not as well as it should be, unfortunately.
We're working on it.
Why does it seem, well, let me throw a generalization at you and you can kind of go from there. Is it inevitable that at some point in our lives, no matter male, female, young, old, that we're going to have an issue with our back? Is that a fair generalization?
Yes. I mean, most of the studies say that up towards 80% of the population will at some point in their life experience low back pain. So it's ubiquitous at all ages, very common. One of the most common reasons people visit their primary care physician.
Okay, so that leads then to the next question, and I'm sure there's a bunch of answers to it, but why is it, that's a huge number, 80%, why is it inevitable that we're going to have issues?
I think the mechanics of the spine and partly part of it, and people have a lifetime of heavy labor doing work. As we get older, things don't compensate as well as it used to be. We lose strength. And so I think things just begin to break down over time, or we overload it with activities we do sometimes, be it work or recreational activities. The back's just a vulnerable area of the body. It's involved in most everything you do, every motion. I mean, people are surprised that never have back pain when they get back pain, how much they can't do because they're like, this is debilitating.
Yeah, so just going to use that word, debilitating. If you haven't had it, when it happens, it's kind of like, oh my goodness. Amy, when people present themselves in the clinic, where's the percentage stand of it was just a general pain that grew worse in comparison to the acute, I bent over and all of a sudden, what do you see?
We see a little bit of everything, Tony. Honestly, the presentation, a lot of people, the acute pain comes in because it's extreme. And these people, like Dr. Lively was saying, they can't do anything. They're almost to the point where they're panicking. They can't work, they can't sleep. So we definitely see, I'd say, probably at least a third of our population of acute low back pain. But then we're also seeing the chronic low back pain where people say, I've been dealing with this for 15, 20 years. They go through a whole plethora of treatment options that they've been through. Nothing's really overly successful. And at that point, we're kind of delving into some new ideas for them, maybe some lifestyle changes that need to be taken. And again, we're seeing a little bit of both of the acute and the chronic side of things.
Matt, let's talk a little biomechanics here because you mentioned earlier that the back is being asked to do so much. Can you walk us through, now not medical here, but layman's understanding of what we're asking our spine to do and our lower back to do on a day-to-day basis?
So the spine's basically building blocks. It's a bunch of blocks of bones they're interspersed with discs or like jelly donuts in between, and so the jelly donuts or the discs are kind of the cushions for the blocks. But what we're doing is, the spine is straight, but we're asking it to bend multiple ways. I mean, bend forward, bend backwards, bend sideways, twist. And so once you start changing the mechanics and the ligaments and the discs that are there to hold that, sometimes just get overloaded because it's not a static position. We change it so much, and that can lead to the breakdown in certain areas.
Amy, it's interesting. We're talking low back pain here today because most of the time when it's the back, it's the low back. Now you can hurt your middle, you can hurt your upper, right? Why is the lower back the biggest area of problem?
I think really what we're looking for in the clinic is we consider it called regional interdependence, which means, yes, a lot of times the back is what's presenting as the painful unit, but we really need to consider there's a lot of things contributing, whereas a lot of times it's something that's going on in the hips that if we're not addressing, hips play a huge part in what's going on with low back pain. Or again, looking up the spine, the thoracic spine, the cervical spine, some hypomobility. Basically, our body is a machine. So if something's not working the way that it needs to, there's another part that will break down. And unfortunately, for a lot of people, it really does seem like it's the low back.
Matt, what's the biggest thing we do with perhaps not knowing it that abuses our back? How do we treat it poorly?
Lifting, usually improper lifting. I mean, people, just bend over and pick something up, and in the spine, again, that's that extreme bending forward that the discs kind of changes the pressure in the discs because they're a jelly. So the jelly will move from an area of high pressure to low pressure, just like any fluid dynamics. And so when it goes out the wrong way too far, then you can end up injuring your back. And so that's why it's encouraged to people, bend with their knees and lift with their spine more straight than bent, because it's less of a risk.
Okay. And that's kind of lifting 101, but I think you said it about as well as I've ever heard it said. When you are lifting something, the best way to lift it is to try as best as possible is to keep your spine straight. And it's when you're curved and then you pick up, you're asking yourself for a problem.
Right.
Yeah. Good stuff. Good stuff. All right. So that's the whys as to what's going on in that back. When we come back, we're going to figure out, how do we fix it? What are the treatment options? And that's something that Matt and Amy do on a everyday basis. So stay right there. We've got more coming up. We're talking about the treatment of low back pain. Thanks for being with us. This is WAJR's Ask the Expert, sponsored by HealthWorks, Rehab, and Fitness.